We continue on chapter 7, which is on routes and formulations. And we've been talking about intravenous sites. So the several sites on the body are used to intravenously administer drugs. The veins of the intercubital areas, which is the front of the elbow. Let me point this out here. The back of the hand, as you see here, and then some larger veins in the foot. On occasion, a vein must be exposed by a surgical cut. Right. So please note those particular injection sites for IVs. Prevention formulation administration device, there are several. The syringe, infusion pumps, and what's called electromagnetic pumps. So with syringes, you have simple syringes and needle setups can be used to inject formulation over a short period of time, generally up to 2 minutes. When we talk about infusions, infusion is a gradual intravenous injection of a volume of fluid into the patient, and it could use a large volume from 500 milliliters to up to 1 liters. A lot of times to infuse medicine or to rehydrate the patient. Something that can be very helpful, as you can see here, in that gradual infusion of the volume of fluids into the patient is what's called an infusion pump, and this is what you see here. Okay, so administration devices that are dependent on gravity flows have been shown to have a variable delivery rate. To ensure a constant delivery rate, controlled infusion pumps are used. Infusion pumps controlled by patients are called PCA or patient-controlled infusion pumps. All right, and so these particular pumps are pre-programmed, and they allow for a constant flow of volume into the patient. So the key definition that you should be familiar with is diluent, a solvent which dissolves a freeze-dried powder or dilutes a solution. You have what's called injectability, the ease of flow when a suspension is injected into a patient. Then you have syringeability, the ease with which a suspension can be drawn from a container into a syringe. Okay, let us move on to now intramuscular injections. Very, very important in many different ways. These are drugs that are often given by, well, let me put it this way, drugs that are often given by intramuscular routes to the patients who are unable to take them by viral administration. A lot of times vaccines, you know, there are not too many oral vaccines, so it's given intramuscularly. Intramuscular or IM injections are made into the muscle fibers that are under the subcutaneous layer of the skin. It should be also noted that the same injection may be as far as possible from major nerves and blood vessels in order to prevent nerve damage and accidental intravenous administration. Intramuscular injections usually result in lower but longer-lasting blood concentrations compared to intravenous administration. And then there are certain key definitions that you should be familiar with as it relates to intramuscular injections. One, colloids, particles used up to 100 times smaller than those in suspension that are, however, likewise suspended in solution. And depot, that is the area in the muscle where the formulation is injected during an intramuscular injection. Those are some of the things that you should be familiar with. Okay? So let's look at intramuscular formation. As you can see here, The needle, which is usually longer than what you see for sub-Q, is much longer. All right. So here you have again the epidermis layer. This dark layer is where you form your skin cells. Here you have your dermis layer. This is your subcutaneous layer or hypodermis. And then you have the muscles. So care must be taken with deep IM injection to avoid veins, arteries, or nerves. In adults, IM injections are given into the upper outer portion of gluteus maximus for children, and some adults, eye injections given into the deltoid muscles of the shoulders. And then we have a definition of depot, which we talked about, is the area in which a formulation is injected during an eye injection. So right here, where I have the cursor, would be considered the depot. Different formulation, of course, will have different routes of absorption. Okay, so where can you have intramuscular injection? Here, deltoids. Again, adults use the gluteus maximus, gluteus medius, the botryleo, and botryllateralis. Let's talk now about subcutaneous injections. And some of those injection sites could be the lower abdomen, front of thigh, upper back, or back of upper arm. So the subcutaneous SC route is a versatile route of administration that can be used for both short-term or very long-term therapies. Absorption of drugs from subcutaneous tissue is influenced by the same factors that determine the rate of absorption from intramuscular site. Many different solutions and suspensions are given subcutaneously, and the most common that you see is insulin. In spite of the advantages of this route of administration, there are also precautions to be observed. For example, drugs that are irritating or that are in a very viscous suspension may produce serious adverse effects, including abscesses and necrosis. And of course, this will be painful to the patient. Okay, let's continue to look at subcutaneous formulations, usually for administering the medication below the skin. Again, you can see that here. And this will be the depot for this type of subcutaneous formulation. Outside of the upper arm, top of thigh, lower portion of each side of the abdomen. Often have a longer onset of action and longer duration of action in comparison to IM and IV injection. And the reason for that is very simple. You know, if you inject is IM, it's close to many times to a vessels that are associated with the muscle. Of course, we talked about if you inject into the vein, takes about 20 seconds for that particular medication to go around the body, because that's how long it takes for circulation within the body. Why subcutaneous formulation takes such a long time? Because it's going to fatty tissue and take a long time to get through that fatty tissue to get into a vessel, so that now the body can react to it. And the limit here is 1.5 milliliters injection of volume. Implants, there are many different types of implants. This allows for long-term control and release of medications. Implants are much simpler for many patients because it is convenient, it's out of the way. A lot of times it's placed under the arm, and increase of patient compliance. And certain drugs that fall under this particular category as Viagra, Duros, Supralin, LA. Okay. All right. is there's certain key terms that we should be familiar with in relationship to implants, our biocompatibility. That means not irritating or does not promote infection or abscess. Because again, it's going into the hypodermis or subcutaneous layer. And then you have viscosity, the thickness of the liquid, or a measure of the liquid's resistance to flow. Okay. You're probably asking what are these particular drugs that are mentioned there. Biodoros implants are made of titanium alloy and are capable of delivering a drug for up to 1 year. So this is a drug carrying type of drug, and the drug is placed in this particular implant, and it slowly absorbs into the body. It has what's called Suppressilin LA. This implant lasts for like a year, and this is to treat children with precocious puberty. And then you have other drugs like Suppressilin LA, which has the capability again lasting for a year and allowing drugs to be placed within it to be released over a long period of time. Let's look at intradermal formulations. Again, intradermal is between the epidermis and the dermis. And you have to be very good, very skilled to give this particular type of medication. It's good for local anesthesia, diagnostic tests, immunization. This is where you will do the skin test for tuberculosis and for allergies. Okay. Yes, before I pass that, there's a few things I want to note. I already said them already, but some of it. Intradermal injections involve a small volume that's injected into the top of the skin. Again, right in this particular location here. And intradermal injections form what is called wheal or raised blister-like areas from which the drug will slowly absorb into the dermis. And the dermis is located under here, just dermis here, epidermis, dermis, hypodermis, or subcutaneous tissue, muscle. The usual site for intradermal injection is the anterior surface of the forearm. There's some key notes to better understand intradermal formulations. Here, when we talk about ophthalmic formulation, we're talking about formulation that goes directly on the eye. Of course, you won't use a syringe at the eye, but other types of medication or formulations, such as ointments, can be very helpful. Of course, liquids can be also very helpful. So drugs are administered to the eye for local treatment of various eye conditions and for anesthesia. The major problem with ophthalmic administration is the immediate loss done by the nasal, by the natural spillage from the eye. Try to put something in your eye like a Visine, which is used to treat dry eye. And most of it spills out because it's an automatic response of the closing of the eye. So other problems include lacrimal tear drainage and very rapid absorption by the eyelid lining. So most ophthalmic solutions and suspensions are dispensed in eyedropper bottle, again Visine, over the counter to deal with minor eye pain, dryness, etc. It's used in this particular manner. To maintain local contact between the drug and the surrounding tissue, sometimes a suspension and ointment is added. And contact lens and soluble inserts can also be used to deliver an ophthalmic dosage. Okay. So again, ophthalmic formulations, local treatment within the eye, a major problem in relationship to spillage, limited volume remaining eye up to 80% loss. Tearing also caused the loss.